He had an abdominal injury, Ray, 17-year-old young man, totally healthy otherwise, Andre Jackson, had an abdominal injury. You get hit in the stomach, and we worry about organs getting injured with an abdominal injury. In order, usually spleen. We talk about that after mono. Liver is number 2. Rarely are what we call the hollow organs. The intestines are hollow, as you know. They're not solid. So the first 2 I mentioned are solid organs. The hollow organ of the small intestine is pretty unusual. It kind of has to be trapped on the hip against something hard, like usually the backbone, the vertebrae, to be trapped and lacerated. And the problem is when the spleen is lacerated, kids have a lot of pain. It bleeds early on a lot, and you tell right away that their heart rate starts going up, their blood pressure goes down, a lot of other things that we look at as far as their vital signs. With a bowel injury to the small intestine, it takes a lot longer before things develop. So it's not as straightforward right off the bat. It's a little harder to see with some imaging tests. So even if people go to emergency rooms sometimes as they look at different things, this is just a very difficult thing to diagnose, very difficult thing to deal with, very unusual presentation and problem. And so all the way around, it's just a real sad situation.
It was a freak accident on this type
A freak
of thing.
accident, yeah.
Because Coach Rotsky, I saw an interview with him afterwards, was saying, it's just a normal hitting play that you see in football every day.
Yeah, as he looked at the film, he said this is the kind of hit that happens all the time in football. It was a pooch punt, and somebody gets hit in the belly, but it must have just been the wrong freakish positioning of where the small intestine was, and it went on to a rupture. Or whether there might have been something else going on in the intestine to put it at risk for a rupture. But either way, it's really an unusual thing. And in the sport of football, there are a handful of cases every year. We talk about them usually when there's one in our region, and this unfortunately hits very close to home. There's usually in a year somewhere in the range of 8, 10, 12 deaths a year of people playing. You and I talk about the 3 H's first. Heart, head, and heat are usually the 3 things that are most put people at risk for death. This wasn't any of those. There was a spleen rupture in New Jersey last year where a young man died playing football. Now, there's a lot of debate by other people about this. There are over 1 million kids that play high school football. When you add college and pro onto it, it's about 2 million kids who play. So you say it's a 1 in a million kind of, it's very, very rare. And so a lot of parents ask, do we have to pull our kids out and all this kind of stuff? These are very, very rare. And other people say, hey, you have almost as much chance driving on the freeway on the way to the game to have an accident and have this happen. So it's not for me to sort that kind of stuff out, but I just feel for everybody involved, this was a healthy kid and really a kind of a freakish thing, Ray, that we don't see very often. A small bowel laceration leading to peritonitis, they call it, which is an inflammation of the covering of the intestines. Inflammation, then it kind of rapidly goes downhill, and it's not easy to pick up early on. So these are all really tough when they occur.
Correct me if I'm wrong, he passed away in the hospital, is that correct?
On Sunday night, yeah. It's really odd. We have a group of all the sports medicine docs in town. We have a big bonfire early in the year. Last Thursday night we had this. We review about 4 or 5 articles in the literature. We reviewed blunt force trauma to the abdomen, and we were talking about things. I was talking more about spleen, but one young man raised his hand and said he'd had a small bowel laceration himself. And we were like, wow, that's really, really rare in the audience. And so we talked about it last Thursday night, and this injury happened on Friday.
Dr. Joe Congeni with us, Sports Medicine Center at Akron Children's Hospital with us live in studio. I was at the store getting some equipment for my kids. GS playing soccer, Rocco playing baseball, and you're seeing more and more of these. And I wanted to ask you about these because we've talked, I think, briefly when they first started coming out, and this type of injury, even though it's related but not because it's supposed to help with blunt trauma, are these little vests that they wear that covers the heart a little bit for soccer, for football, and those type of things. Talk about that piece of equipment, and should parents really look at purchasing that?
I think it's not a bad purchase for baseball and soccer particularly, but particularly baseball. There's a very something we talk about usually in summers because there's a couple cases that happen in this country every year in baseball. So we just said, hey, these things happen in football, they happen in baseball. Are we going to keep our kids out of everything? In baseball particularly, a couple have occurred in lacrosse when a small object hits the heart during a certain time in the normal electrical cycle of the heart goes into an abnormal rhythm in some situations, and a couple kids die every year from a thing called, long name thing, commotio cordis. And anything that, because it is a certain age range from about age 12 to 16, when there's not a lot of muscle around the chest wall, there's not a lot protecting the heart, and this hit directly in one spot of the chest wall, left side, where the heart is, can cause the heart to go into an abnormal rhythm. And so there are these kind of, for a while they were calling them chest protector, heart protectors.
Yeah.
And now they have much smaller ones that just go over that left side of the heart, and you wear it, and it protects the heart. And for a sport like baseball particularly, I think it's not a bad idea.
All right, Dr. Joe Congeni with us, 1590 WAKR. I was reading some good news. Indians get the Central Division. That's not the good news. That's great news. But the good news, I was reading that Danny Salazar was doing some tossing down on the field. Originally, when this happened, we said, oh, boy, he might not be able to come back. Talk about his, quote, dead arm syndrome. How long does it take a player to come back? I'm not necessarily saying throwing, but to get in baseball-ready shape, Joe.
Yeah, so variable, as you know. But I heard you even talking with a gentleman by the name of Bob DiBiasio, and I was glad to hear, because he's on the inside. He knows. We don't know, not seeing Salazar. But the fact that they thought maybe by the second series or third series he might be able to help out of the bullpen, and that's about what it is, unfortunately, for pitching. So when I get a baseball player ready, it takes a couple of weeks to get them baseball ready, and then it takes about a month to get them pitching ready. It takes 4, 5, 6 weeks to really get them back totally with an arm injury like that, to get back to really being ready to compete and pitch. And as you know, maybe not in the role that he had early in the season. Gosh, at times in the season he might have been our number one almost. But maybe somebody who could come in. He's got that strong arm, that that power arm, and maybe he could come in some relief situations later in the playoffs. That's what they're saying. I'm thrilled to hear that. And also, I thought you were going to ask me when we were talking about good news, was Corey Kluber.
Well, I was going to ask you, mild strain quad, saying 7 to 10 days. I'm a little bit concerned. Should I be?
Anytime you tell me that, I'm a little bit concerned too. But no, very cautious. Good time of year to be very cautious. He is the horse. He's the guy we ride. There's no doubt about it as an Indian fan. So I take Tito at his word, and I say it all year. And Tito, I trust. He got him out in a cautious moment. Everybody said everything was okay and he should be fine to go. So I'm happy about that. One other thing I wanted to mention when it comes to quad, and his might have been a groin a little bit more, but a group we haven't talked about this fall are the soccer players. Last night I was at the Jewel of Akron, the soccer facility as the University of Akron's men's soccer team had a home game. If you haven't seen, this is about as high a level as it gets in soccer.
Yep.
The facility's as good as there is in the country. The backdrop of the beautiful, what's been built in the campus all around the field. The stands are filled with soccer purists. I have a fellow this year that's from South America. They just love that soccer being played at such a high level, if you haven't been to one of those. But anyway, I've had a run on these quad injuries where soccer players get kneed or kicked in the thigh, and it bleeds quite a bit when they get a bad deep bruise, and it can actually harden. It's the thing we've talked about before called myositis ossificans. So the wrong thing to do is immobilize them, put them in an immobilizer and say don't move it. Actually get it moving early. We want to mobilize and get that blood out of the thigh from the deep contusion. And the sooner you do that, the more you're going to reduce the risk significantly of this hardening called myositis ossificans. The more you put them in an immobilizer, put them on crutches and say don't do anything for 7, 10, 14 days for a soccer player, the more problem it is. So initial management, deep contusion, get them into somebody who knows something about physical therapy, their athletic trainer if they have the time to do it, and make sure we mobilize these things and get that deep contusion or bruise moving.
All right, Joe, thanks for coming in. Great stuff this morning. We'll see you next week.
Thanks, Ray.
There you go. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joining us live this morning.